Okay, so today I'm going to show you how to enter referral and work with a pending patient encounter. Almost everything is identical between home health and hospice for this.
Right.
Yes.
Were you going to start with the
waste basket?
Not the waste basket. The work basket.
Yes.
We didn't get to that yesterday.
Yeah, we'll cover that first. So I'll be going through Workbasket, but then we'll be going through the referral setup. Almost everything's the same. I will show you the one screen that's truly different between home health and hospice, and it's just a minor change for the referral process. So before I actually get started with today's training, we're gonna go to Workbasket setup. So I'm gonna show you how to assign a Workbasket to individuals. So I'm going to go to the settings menu. I'm going to go to the Workbasket items, and I'm going to go to user rules. Okay, now Workbasket is your electronic to-do list. It's got 3 sections. The electronic to-do list is one, which has action items, and that means that you've got to do something to complete something in the system or move it to the move it to the next step in the system. The second piece is the communications piece, and the communications piece comes from the information that you enter on the Associate Notes tab and information that you enter on your Physician Notes tab. So that's the communication piece. Then the third piece to this is called notifications. The notifications are more automated things. For example, notification will tell you when you enter a referral. So everybody that's assigned that notification will know that you got a referral and who it is. Then if you determine that you can't accept that referral, then you would change it to a non-admit. Everybody get that non-admit notification. If you decide you are going to accept the referral and activate the patient, you'll get a notification saying the patient's activated. Then if you discharge the patient, you'll get a notification that patient's been discharged. Okay, so those are the 3 basic pieces to Workbasket. Now the action items have action categories. Excuse me. In the table, it's known as groups, but I also refer to them as action categories. So there are Workbasket action items associated with accounts receivable. There are Workbasket action items associated with admission, agency, and hopefully you'll never see this one. There's one for associates, case communication, and so on. Each one of these categories has a group of action items that are associated with that category. So you'll actually be working with those action items. So if I were to change this, let's just change it to clinical records so you'll get an idea. Okay, so this is my clinical record category or group. So you can see you've got approval of certifications, interim orders, clinical update, case communication information missing, continued services or discharge, or his records missing, or it's not locked, which means it hasn't been approved, so it's not ready for transmission. Your interdisciplinary team review is missing, and so on. So these are the items that are sitting under clinical. So when you look at some of the other ones, they're not quite as long. So if I went to associates, you can see associate doesn't have as many. You've got compliance items, communications and notes information, and you have incomplete associate information. Incomplete really means that you've set up your associate, so it's a brand new associate you entered into the system, and it comes across to begin with in an incomplete status because you're still missing information once you activate the associate master file. So these are different types of things that fall under the groups. Now I'm going to remove my check marks real quick because I want to explain this. Okay, so when you're assigning Workbasket to individuals, your individuals will have to, first of all, have access to that, so their permissions should be checked off if they, for the items that they would have access to for them to receive Workbasket. Now, Workbasket has three phases. Phase one is typically the person who's responsible for the day-to-day activity. That's something they do all the time. Every day it's part of their job. Phase two is that a person's supervisor or manager, so somebody who oversees those individuals are responsible for the day-to-day activity. They would be in phase two. And phase three is typically your senior management. So when you're looking in Workbasket, when it initially goes into Workbasket, this is when I click this because I want the color. When it originally goes into Workbasket, the background to the Workbasket is white with black font. When it gets escalated to the next phase, which means that didn't get done within a specific time frame, then it moves into phase two in Workbasket. And when you see it in phase two, it's a yellow background with a black font. Then when it moves to phase three, because it didn't get done within a specific time frame while it's sitting in phase two, it moves to a red background with a white font. So again, these are typically the people that are responsible for the day-to-day activity. This would be their supervisor or manager that oversees those individuals, and this would be for your agency management. Now, when you're assigning Workbasket, anybody that is responsible for the day-to-day activity, you want to make sure that you check phase one, phase two, and phase three for that individual. If you only check on phase one, it will be removed from their Workbasket when it gets escalated to phase two. So they need to be able to see it escalate. So they'll see all three background color codings. They'll see white, yellow, and red. When the supervisor or manager gets it in with their Workbasket, you would assign it to phase two and phase three. So they'll see it when it gets escalated into phase two. So that would be the start of their Workbasket. And it has a yellow background. So they'll see just the yellows, and then when it gets escalated from phase two, then they'll see it in red. Then your senior management that you've only assigned phase three, they'll only see it when it hits their Workbasket, when it has the red background. So that allows you to see the escalation flow. So you make sure that if it's somebody that's responsible for the day-to-day activity, you check phase one, two, and three. Their supervisor or manager, you would check phase two and phase three. And your senior management only want to see it when it hits Workbasket when you think there might be an issue. Either your business is growing and you need to throw more resources at the task. Maybe somebody's on vacation and nobody's picked up doing the work. Could be a combination of things. So by the time it gets to phase three, that's when you really want to look at it and see, maybe I have my process is broken in that area. So that's the escalation process. So if you're a senior manager, you want to make sure it all gets done in an appropriate time frame, and you're only interested when it gets to your level, which is phase three. Now I'll just quickly show you Workbasket so you can see what I mean by the color coding. I think my clinical Workbasket in here, somebody changed it, but I think my clinical Workbasket has yes, okay. So this is when it first hits Workbasket, and there's a time frame associated with the item that hits Workbasket, and if it's not completed within the appropriate time frame, then it moves to phase two. This is phase two with the yellow background. If it's not completed within the appropriate time frame, then it moves to phase 3, which is the red background. I typically see a whole lot more of this in clinical because it's got the largest workbasket task. So if you think about things that you do from a clinical perspective, you're writing orders, you may be approving orders, you send them out the door, and so on. And so you'd be able to follow it all the way through tracking in Workbasket up to the point where the you can put a signature received, and then it's done with Workbasket for that one item. So you could have one item that goes through many steps until it's completed. Okay, I do have a question. Will staff clocking in and out appear in Workbasket? No. There's other information for time frame. Some of it you'd be putting the information in. If you plan to use the EDV, that will show up in the associate file as well as the patient file. Okay, so that's how Workbasket functions, and this just gives you a brief picture of what Workbasket's going to look like. We will, towards the end of the training, I'll go back through and show you all the features and functions in Workbasket. Okay, I have another question. Are the timeframes set up for each of the different descriptions? Yes, they are, and they can be changed if you're not happy with them. So, for example, you may activate a patient with missing information. It is set up so that it automatically goes to Workbasket. That could be changed, so if you want to give somebody another 2 hours before it hits Workbasket, then that can be changed. So we do give you a baseline set of time frames for all the Workbasket tasks, and they can all be changed, any one of them, anyone within phase 1, anyone within phase 2, and so on. So we will work with you on that if you want them changed. Some locations think they're too aggressive, so they can be changed. So if you've got stuff sitting in Workbasket that got escalated to phase 3, that's all in the same day, we can take a look at changing that for you. Okay, then my next question, do you assign the Workbasket level for each associate or each task? This is done by associates. So let me go back to Workbasket. Workbasket, it's users. And you're going to select your user from this list. And then you will be assigning all the different tasks to this user. And so you're doing it by associate, not by task. I can tell you, you can do that the opposite way. This is more efficient. So there is another path to do that, but I had not planned on showing it to you because this one, yeah, the other way you have to do it by phases. And this one, you just pick an associate and say, okay, they're responsible for the day-to-day activity here. They get one. They're responsible for level 2 and 3 on this one, and maybe they only get level 3 for this one. So you get to pick and choose how you want to set up Workbasket. So just because they start off with level 1 doesn't mean everything that's sitting out here would be in phase 1. Okay, so that's pretty much setting up Workbasket and assigning it. So now we can move on to today's training. So I'm going to show you how to enter a referral and work with a pending patient encounter. So I'm going to go to my patients menu. I'm going to go to the add referral patient option. Now you will be able to add referrals under the patient encounter option as well. There's a link once you get into it that you could add a referral, and there's also a link down the left-hand side of the home page, which is the initial page you see when you first sign in. So when you select this option, you're going to see that entering a referral has 4 steps. You have creating the referral, which is the page we're starting with. You have the patient setup, so what you're really doing is searching for a patient. You have contact information, which would be the patient demographics and their contacts. Then you're going to finish up the referral. Once you finish the referral, it turns into a pending patient encounter record, which is actually the beginning of your electronic medical record. Okay, so on the create referral, I need to select a specific agency since I have access to more than one. I also have different agency types available to me. Excuse me. Okay, so I'm actually going to take you through the home health agency path. When we get to the page that is a little bit different for hospice, I'll show you that page. So I'm going to take you through home health. Now, in the referral source section, you have a drop-down list that will show you the referral sources that you previously used. So instead of having to go and search for one, if you've previously used them, you can select them from the drop-down list. So if I were to select one of these referrals because I previously used them, then I get their name, phone number, and some additional information. Now, if there isn't a referral source I previously used, I would select the Find Referral Source, and it's going to look through the referral source master file, which includes all your physicians, facilities, as well as other referral sources. And if it's a brand new referral source and you're on this screen putting the information in, you'll be able to add that referral source with minimal information. Workbasket will keep track of what's missing for that referral source so that you do not have to worry about going back and updating it or keeping track of that, because Workbasket does that for you. So if I select a referral source, then I'm going to get some referral history for the last 90 days. And then I've got my method of delivery. So when you're looking down this screen, you notice that you still have these little orange asterisks for information that's required. So some of this information is not required. It's nice to have if you want the information, but they're not required. Well, some locations like to keep track of method of delivery, which means they got their referral from a phone call, they got it through a fax, maybe an encrypted email, or maybe somebody was with the referral source when they gave you the referral. So you could collect that type of information if it's of any use to you. Otherwise, you can leave it blank. Now, referral source contact. In the referral source master file, there's a section for contacts for that referral source. You can identify those contacts as part of that referral source file. For example, this referral source was a physician. So in the physician's master file, there's an area for the contacts. You could have an office manager, you might have a nurse practitioner, you might have a physician assistant. It might be another nurse in the office. So you'd be able to enter that type of information for that contact. And so when you select the referral source up here and you have the contact information, then all you have to do is select one of them. If it's a contact that's not in the system and linked to that referral source, you'd be able to add that referral source contact from here. When you add it from here, it will update that referral source's contact information for you. So you don't have to remember to go and do that either. So when you bring the information over, if you select one that's sitting out in the file, when you bring the information over, it displays on the screen. Now, if you need to make a change to something on the screen, like let's say I need a different fax number, and let's say that could have been the fax number, whatever information you change on the screen will also update that referral source contact section. So it will make all the changes even if you put it here. Okay, now we're moving into the initial referral information. You have a section here that identifies a payer category. These are standard categories in the system: Medicare, Medicaid, insurance, private pay, and so on. There are other filters and search features that use this category coding to make it easier to look through some of the information. Now I'm going to assign this one to Medicare. Let me see. I have another question. Can we change some of the optional fields into mandatory fields? We might be able to do that. There's nothing in the system that does that now. If you think after a while you want something mandatory, um, we could take a look at doing that, but there's nothing that allows that to happen today. It will allow you, I have another question. It will allow you to have two different sources. Are you saying two different referral sources? It does not. It does not allow you two different referral source contacts either. And then I've got another one, i.e. you have Ames, Allen, and Arnett. This is the referral source. So this would be part of your referral source statistics. This is the contact that you'd be working with at that referral source. I'll give you a different example that might make a little more sense. You have a managed care payer. That managed care payer is your referral source. You could have 10 different case managers at that referral source that you're working with. They would be the contacts. So that would be the difference. This is a referral source. This was a physician. This is the contact you're working with, and this is the physician's assistant. But what it keeps track of for referral statistics is this. Okay, that makes sense. Okay, got it. Great. Okay, so back into the initial referral information. Payer category, again, this is the standard categories that are in the system. Referral date, we do default this to today's date. You can backdate it, so if you collected a referral on paper over the weekend and come Monday, you're keying it into the system, then you can backdate it to a Saturday date if you needed to. Requested start a care date. Now you can see that this is optional, and it's truly because some referral sources will give you a requested start a care date, like a physician will call you and say, I want you to start tomorrow. Versus you're talking to a hospital discharge planner and they say, I'm just trying to get you this referral source now. We're not sure, but we plan on discharging this patient within the next couple of days. So they don't have a requested start a care date for you, so you can leave it blank. Okay, as part of the billing process, there's something called admission source and admission type. Some locations know this now, so they put it in as part of the referrals process, and some locations do not know this until they're activating the patient. Now, based on the information I'm taking for the referral, I pretty much know this now. I know it's a physician referral, but the person I'm working with is a physician's assistant. So it could be the clinic or physician's office, but you could check it physician referral. So this is the standard list of items. This information is part of the billing process. So I'm going to go ahead and select one of these. Admission type. Most of these I see set as elective. Every once in a while I see one that's newborn, non-Medicare payers. You don't typically have this on their claim, so you could list information not available. But since this is Medicare, I'm going to select it as elective. Now in the discipline section, and because you're doing both home health and hospice, you're going to have quite an extensive list of disciplines sitting here. So since I set this one up for home health to start with, I'm going to start with skilled nursing. And because we're going to come back and revisit this a little later in the referral process. I'm just going to start with skilled nursing. Sitting over to the right of this tells you the number of active associates that are in your agency. So this one says 25 for skilled nursing. If you hover over this, you'll see a list of all your associates. So those are all the people that are classified as skilled nursing in my training environment. So you get a complete list. So here's one for your physical therapists and so on. So you'll get a complete list. If you are using the territory assignments, which means that you blocked out a specific area and assigned them to associates, and you have the patient zip code where you're going to be seeing the patients, then you can enter the zip code down below this list and select the show associates and zip code. And it presents you with a second column that shows you all the associates that you have available in within that zip code territory. So that the zip code I put in is where you're going to provide the service to the patient, and you can see that I have a few accounts for some of these. So for skilled nursing, those that have been assigned to a territory that fall within that patient's zip code, now it says 19 in this column. If you hover over it, you see the list as well. Where this can sometimes be helpful is if the patient's really at one end of the your agency's coverage area, and the only employee you have available is at the other side, and they may have to drive 75, 80 miles one way to get there. Maybe you don't want to accept the referral. So it just kind of helps you determine, can you accept the referral or not? And other things will help you determine whether you can accept the referral as well. Now, sitting down below all of this, you have the ability to decline the referral. If you select that radio button to decline the referral, you're going to get a pop-up that allows you to provide a reason for why you decline the referral instead of continue with the referral process. Now, if you continue with the referral process and you're all the way through and create your pending patient encounter record, you still have the opportunity to decline the referral. So this would be the first opportunity you would have to do this. So somebody could be calling you and saying, I have a patient that's looking for private duty care. We're going to pay for the services privately. And they may just be price shopping. So you give them the information, they say, okay, thank you very much, and I may be calling you back, and they hang up. So you really don't have a referral yet, but you've got some information. You can also have, maybe they're outside your service area. Maybe somebody further up north from Santa Barbara is outside your service area, calls and said, I hear you guys have a great reputation, and I'd like to see if I can get service from you. And you say, I'm sorry, you're outside our area. So you'd be able to use that as well. You could have those where services are not covered, or maybe you've got this coming from a managed care payer and you don't have a contract with them, and maybe you need to consider getting one. So there are several different reasons you may not accept the referral. So for my training, I'm going to say I'm moving forward with this. So I'm going to select my save and continue. Okay, I have a question. Can we run a report on the reason for decline? The dashboard has a chart for your decline referral statistics. And so you'd see a graphical view of those statistics and that information, and it's a detailed report that you can look at that's created for the statistics and dashboard. So yes. Does this connect directly to the electronic referral from the hospital? No. Was that a good answer? Okay. So once you're moving forward, thank you. Once you're moving forward and you determine you're going to continue collecting referral information, just hit your save and continue. Okay, so now I'm on my second step. This is the setup for the referrals. I'm on my second step. Some locations are able to collect the face-to-face physician information during the referral process, so they put it in here. You can collect it here, but you also have another way to collect that information when you're sending out the orders. And if you don't put it here and the patient's still pending, you can enter the face-to-face information at a later point in time. What this one does is it allows you to search the physician file and come up with a face-to-face. I'll just quickly show this to you. Oh, does it need two characters? Oh, I haven't. Okay, so it just presents you with the list of individuals. So I could have typed in a whole name, but so I'm going to see if I can get the face-to-face. You can enter visit date information, and you have a form that you're completing. So this is what you're doing. And if you decide you want to use the referral as an initial physician order, you can send the face-to-face information along with it. So you do have that ability here. Now, when you're working with this information for hospice, you do not have this face-to-face information for the referral, but what you do have sitting here is some additional admission criteria. So I got that one. Oh, I did. Hold on. Here we go. I got this is what the hospice one looks like. For hospice, you're going to be able to document any admission criteria. And of course, you can leave this blank if you don't want to put any of the information in here. But you can identify where you're doing the presentation. So you might be doing or providing the service at home, but you may be doing the presentation in a skilled nursing facility or a hospital or something. So you'd be able to identify that. I'm just going to select this as home for now. If you were doing some type of facility, your additional information could be a floor and room number. If it's separate wings, you could have that type of information. Then for your place of admission, I said I was going to do this at home, and I'm going to set it from home. For hospice admission date, there is a CMS hospice admission date. If you know it at this point, you can put it in. If you don't know it at this point, you can put it in when you do obtain that information as part of the Medicare payer. And so that's what the hospice piece looks like. And then the rest of it, I'm going to finish my referral going through this screen. The rest of it now starts your patient search. So I'm going to go ahead and type in some information in my search. Okay. Now, if you knew the patient was being readmitted, you knew you had them on service once before, and you know their medical record number. Some offices, there are people that are doing this, know everything in so much detail. If you have that number, you can key it in. Also, the patient identifier. This one looks in several different areas within the patient master file. If you have a Medicare Beneficiary ID, you could key it in. If you have a Medicaid ID, you could key that in. If you've got a policy number for insurance payers, you can key that in. If you have the patient's Social Security number, you can key that in. So what this search does is it checks through the entire patient encounter file and finds patients that meet any one of the criteria. So they don't have to meet the whole thing, but any one of the criteria. And so if I put in a Medicare beneficiary ID and it was for a different patient, that would pop up. So it would meet just one of the criteria. Then once you're searching for your patient, you are going to get a list. And so this is where you could readmit an existing patient. So you can see I have several with the last name of Jones. I have 2 with the last name of Craig. I have quite a few with this birthday. If I put in a Medicare beneficiary ID, it would show up over here and be highlighted. It could be the same patient. It could be somebody different. I key in the medical record number. It could be somebody different or the same patient as well. So it's what it is doing again is looking for anything in the patient master file that meets at least one of the criteria. So this is really helpful if you're not sure how to spell somebody's last name or first name, or you've got their birth date. So this is very helpful because it'll find that for you. Now, if the patient has been discharged, they will be available for you to select from. If the patient has not been discharged, so you can see this one's an active patient, there's no check mark in front of them. So if you did get a referral for this patient that I've got highlighted, maybe it should be a continuation of orders for an existing active patient, or maybe you haven't discharged that patient yet. So that could be. Same with pending. I have a referral for a patient that I haven't activated yet. Now somebody else is calling me and giving me another referral for the same patient. So maybe that's when you can stop the referral process because you already have one pending. So if you're going to readmit an existing patient out of the file, you would just simply check the box and hit your continue button for the one you want to readmit. Now, if this is a brand new patient, they don't appear in this list at all. They're a brand new patient. You want to complete this section with as much information that you have available at this time. Only 2 items that are mandatory are last and first name. So at some point, you will be collecting the rest of this information. If you have it during the referral, fine, put what you can put in. If you don't, then the only 2 pieces you need out of here are the last name and first name. Then if you're adding a new patient, you would hit this continue button. Now I want to do the readmit patient because there's a sort of an interim step between setting up the patient and the contact information. So I'm going to go through readmitting an existing patient. So contacts, this is the interim step. You have the ability to copy some additional information over from a previous admission. Now, the 2 things that always copy over are the patient's demographics, and it brings over their payment source. For this one, you have several options here. So you can have all the medications be copied over from a previous admission, including those that have been ended. So you could have a complete history of all their medications, or if you just wanted to have the active ones copied over, you can do the active ones, including advanced directives. Now, depending on when you're readmitting this patient, you may or may not want to copy this over. If you had a patient on service 6 months ago and you're bringing him on now, I probably would not do this because you probably really do need to collect a new set of advanced directives. They could all change in 6 months. Disaster plan. If you discharged a patient last week and brought them back on service this week, maybe the disaster plan is the same. But again, if you discharge somebody 6 months ago and bring them back on service now, I would be inclined not to copy this over because most likely this would be different. Maybe their condition's worse than it was 6 months ago when you're readmitting them to care patient. So I would be inclined not to copy that one. Now, for hospice, this field is opened up, so you can include all the DME that was documented in the previous admission, even though you make arrangements to go pick it up. So you can have the ability to include it. In both home health and hospice, there's an area where you can identify all the vendors that are being used for DME supplies, as well as pharmaceuticals. So for hospice, if you work with one or two hospice pharmaceuticals and DME for them, those are the ones you'd list. Now, some patients may have pharmaceuticals coming from other pharmacies that were prescribed by their primary care physician that are not covered by hospice. So you could include those pharmacies as part of the vendor list. And so if that's all set up in a previous admission, I'd be inclined to copy that over too. For home health, you have some vital sign parameters that you can establish for each individual patient. So there are things like parameters for temperature, blood pressure, pulse, if they have diabetes, diabetes ranges, and so on. So you'd be able to bring those over. For hospice, you would not need to do that because you don't need to have those parameters. Then once you are through with this one, just hit your continue button. And now we move on to step 3. So because I'm readmitting a patient, I already have my address and phone number. So this is the patient's demographics, and I have patient contacts that came over from my previous admission. And then I have something down here called ancillary phone. If you don't have any information here, then this is where you would add the demographics, add the context, and if you do choose to use this ancillary phone section, you could use it. I typically see this whole section ancillary phone blank. Okay, so when you're adding contact information, and we'll cover this again when I go through the patient encounter, but when you're adding contact information, and you put in phone numbers, you're going to identify a preferred phone number that you'd be using to contact the patient. These green check marks means these are the preferred phone numbers. Now I'm going to select an edit. The add contact screen looks just like this, except it says add address phone information instead of edit. So I put this information in. I can have different types of addresses, home, mailing, work. So you can have all of that type of information in here. You can add different types of phones, home, mobile, fax, or work, so you can add those. Once you're adding phone numbers, they will populate this side of this pop-up. This is where you're going to check one of the numbers as preferred. Now, if you only have one phone number, be sure you check that one phone number as preferred. If you don't, there are some screens and reports that are looking for a preferred phone number. The field will be blank. Also, there are some pop-ups, hover over pop-ups for demographics for the patient that will give you all this information. If you don't check at least one phone number is preferred, then the pop-up does not tell you which one's preferred. It just shows you everything that's out there. So just be sure that even if you only answer one, just be sure you've got that phone number checked as preferred. Okay, also on this screen is where you'd be adding your service facility. When we get into the patient encounter file, you're going to see all this information flow into an individual tab for contacts. And so if you don't have it here, you will want to add information there. Once you create your pending patient encounter and activate the patient, then everything that you see on this page will be there for you to be able to edit, update, change, remove, whatever you need to do. Now, on this one for adding a service facility, you want to be sure that if you're seeing the patient in a facility, that you document that facility information here. And if you stop seeing that patient in a facility, that you come in and in the facility as part of the patient encounter. The service facility information that you are adding to the contact information is what determines what billing code, that HCPCS code, goes on the claims. And so that's true for both home health and hospice. Now, this is where you can put in patient contacts. You can add as many contacts as you need to, and you can identify the type of contact they are. You'll have a whole checklist to help you identify the contacts. From a hospice perspective, you do have the same section for the contacts, but if you select somebody for the bereavement program, you'll want to be sure that you collect their address information. So you can see I don't have any address information in here. Most locations that do home health don't put in a contact's address, they just use their phone number. Now this particular one is missing the phone number as well, so I'll probably ought to include that, but at least I have this one and my preferred phone number checked. Ancillary found. Here's an example of when you'd use this. Does not fall in line with either the patient's demographics or the patient's contacts. So this would be an example of one. I typically see this left blank. So you got a phone number here and it just says call neighbor, the patient does not answer door. So that could be a reason to use that. Once you're through putting in contact information you have, you'll hit your continue button. By the way, if you're not able to get any of this information, you can leave the contact info blank because you'll be able to update it as part of the patient encounter. Very rarely do I see it left blank, but you can. Okay, so I'm going to go ahead and hit my continue button. Now I'm on the finish referral, so I'm now at the fourth step. So if you've selected a physician on the Create Referral page, that physician will populate here. I keep doing that. That physician will populate here. If this is not the physician that you want to have listed here, you can change this. So let's say the referring physician was an attending physician from the hospital. And let's say the patient doesn't have a primary care physician and you're going to have your hospice medical director here. You could find your hospice medical director out of the list and assign them. So you also, depending on how you want to set this up, you can identify the type of physician. So in this case, you have an attending physician. And so that could have been the hospitalist that is providing the referral. So that's the attending physician. Certifying physician is typically your hospice medical director or another hospice physician. Sometimes it can be a patient's physician outside the hospice, but for hospice, that's what that would be. Primary care, if you want the primary care physicians listed here, whether it's home health or hospice, then you can identify them as a primary care. Referring physician. Now, this physician that you have listed here may have been a referring physician that is in a group practice and another physician's on vacation. So maybe you would have this person listed as a referring physician. Then there's one not for billing. So not for billing means that we're going to ignore all the edits. That means that the physician has to meet certain requirements to bill. So we would no longer be checking for PACOs, no NPI, no physician license for your state or an active physician license because they're not for billing. Where I've seen this one used is if one of the other physicians is consulting a retired physician, then you could use that, put the retired physician's name in the system. So you'd be able to do that. You'll learn more about that when we get into the patient encounter record about the multiple physicians you can add. So I'm just going to select this as a primary care physician. I have another opportunity to put in the requested start of care date. So you're talking to a hospital discharge planner, and as you're going through this, they go, oh, by the way, I just got a note that we're discharging this patient this afternoon, so can he start care tomorrow? So now you can put the date in. Okay. The rest of this screen, you do not have to put anything in, but if you need some baseline information or basic information that pertains to the patient, you can just put in some type of notes. Now, for the physician's orders, this is the only section that you will have to have something in to activate the patient. So while you're creating a referral, you don't have to have anything here, but to activate the patient, you will. So I usually recommend that you type in physician's orders, and what I usually find is something that reads similar to RN to evaluate. I'm doing great. And so I might find one that says RN to evaluate a patient for hospice, and one RN to evaluate a patient for home health. If it's a physical therapy only case, maybe it's a PT to evaluate. This would be classified as an order because all they're really doing at this point in time is saying, I want you to go out and do one visit and evaluate the patient and assess them and see if you can bring them on service, because that's really what the order is. Now, you can use a verbal order date here. This would be if a clinician took this order and they're putting it in the system, then you can have a verbal order date. So I'm going to go ahead and put that in. And if the clinician who's entering this information can also apply their signature to this order. Now, I actually have my signature already saved in the system. This is from a touch screen where I signed it with my finger, or you can use the stylus. If you choose to use the digital imprint, you can select this Use button, and this is the digital imprint. You can also, if you want to go a different route, I'm going to remove this. You can have a caregiver sign a piece of paper. You can scan and save it on a local PC and upload the likeness of their signature. So you could go any one of these three. So my example when I first opened it was I signed the screen. Most locations are using this digital imprint now because it's easy to use. There is an attestation statement associated with this that says that this is their signature. So if the clinicians choose to share their user access to CareFishent, and somebody else who signed in as them signed a document, that clinician whose signature there is still responsible for that signature. So it's kind of important not to be sharing user IDs and passwords all over the place. So every once in a while, we may have to ask for one, you may have to ask for one so you can see exactly what it is they're doing. But then we always recommend that you reset it, have them put in a new password. No matter which signature you use, you can save it for future use. So that other signature I had sitting here, what I had previously saved. So that's why it popped up. Once you do this one time, then the signature will be available on everything you sign, which could be automated forms, it could be service notes, it could be orders, care plans, IDT documents, and so on. It can be all of them. So when you obtain the signature, just hit the accept. Now this screen doesn't show the signature, but I'll show you where the signature is. So again, you can put things in these fields if you think you need some information, like a surgical procedure could say left hip replacement, nutritional requirements could say low salt, DME and supply. If you got this from a hospital, they sent the patient home with a wheelchair. Doesn't mean that's what the patient has or needs. They could have that wheelchair they were sent home with. They could have a hospital bed, a bedside commode, a walker. They could have all sorts of stuff. So this would just be the information that you would have gathered. Some people will search and give a diagnosis here. And if you are going to put a diagnosis here, just know that it only goes to the referral tab. It doesn't go to your care plan or your 485, any of that information. If you know an ICD-10 code, you can key it in. If you don't, you can key a word that appears somewhere in the description. So this is the ICD-10 code table, and you can see I have the word heart in several of these. Referring diagnosis, this is where you can free-form text information. So if you needed a little history background for this patient, you could put in that they have diabetes, CVA, and so on. So you could type that information in. Also for medications, you're going to be building the medication profile based on your initial assessment. So if you got this and the physician or hospital says, these are the 5 medications I know they're taking. And this patient is saying all sorts of other specialists who have prescribed medications. You get out to their home, they hand you a shoebox and it has 35 medications in it. So that's what you're building the profile from. So if you want medications, known medications, you can key them in here. Otherwise, you can leave it blank. So pretty much when you look at this, the only thing you really do need here is this, because you can't activate the patient without it. This one, I'm going to tell you where this comes in handy is for your Medicare PDGM process for 2021. You are able to use that referral order to validate the referral order requirement. So it's got the verbal order date and the signature that says you did get the order and this is when you got it. So that's where this one's going to come in handy if you choose to use the referral order. Now, disciplines and specialties. I'm looking at this. Somebody told me I had a left hip replacement. They initially said nursing, and you're saying it sounds like they need a physical therapist. And based on some other background information you gave me, maybe a social worker and maybe a home health aide. And so it gives you another opportunity to select from a list of disciplines. Then you have an area down here for skills required. So your skills required, a lot of locations do not use this. Some of them even went into the tables and removed them all, where they put an end date on every one of them because they did not even want them to display in this section. So they have a complete blank area. But if you do have some specialties, like you have a pediatric team, or you have a psych team, or maybe you have wound care specialists who take care of severe complex wounds versus all of the other types of wounds that your nurses could take care of in other visits. You could add that too. So if you do, this is the table that you manage, and it falls under the settings lookup tables. And this one's going to fall under general support tables, and this is the skills. So if you don't want them on the screen, just go in and in the ones that are there. If you want others on the screen, put those out there. If you can use some of them that are there, that's fine. So that's where the table is that you can manage for this. Once you are through with this referral, so remember we're finishing up the referral now, you would select your Continue button. And what this does is it moves everything into the patient's electronic medical record. So this is the start of your EMR for this patient. Now the patient's it comes over in a pending status, which means you haven't accepted them on service yet, so you don't have a start of care date. Some of this information that sits up here populates when you added the referral. Other information, like when you activate the patient, you'll get the start of care date. When you enter allergies in the system, you'll get that. Disaster level, you'll get that information. Advanced directives, DNR. So as you start adding and updating information as part of the patient's electronic medical record, it will update the information sitting at the top. And so just to show you, under contacts is where all that information was that was on the contacts page in the referral. So this is where it's all housed, is on the contacts tab. And you'd be able to make any changes, add, update in your service facilities and so on. So this is where you can do all this. The other thing that flows over from that is your referral information. So here's the referral tab. You see the referral source name information, who the contact was you set up, all the referral information that you've collected. So now you can see the signature. So the signature shows on the referral. You can see where I've entered other information, like I did put in that diagnosis. So if I entered information in any of these other fields, like surgical procedures, nutritional requirements, and so on, then the information would populate here as well. Also, you do have the ability to add the referral face-to-face from here if you didn't do it during the referral process. And what I'm finding is the majority of locations use the orders and the care plan information to generate the face-to-face documentation. So there's several different places you can do that from. Now, this verbal order and signature satisfies Medicare's requirement for PDGM that you have a verbal order. So that's part of that process for the PDGM program. You can print this and send it to a physician. You can fax it over to a physician if the fax number is in the system. When you get this signed order back, you can upload the signed order from here. You'll also have an area to upload the signed order from the Documents tab. But when you're thinking of referrals, you most likely would come to the referral page and just upload it. Okay, so the very next thing you want to do once you create your pending patient encounter is add your payer. So I'm going to go to the Payers tab, and I'm going to add a payer. Now remember, this was a readmit, so it brought over payer from the previous admission. This is not the payer I want because this is Part B for outpatient therapy. So I'm going to add my Medicare Part A payer. Now, in your environment, you'll have more than one Medicare payer. So if you recall on the create referral page, which was the first one, I selected a payer category. So I'm going to select this category, and this just gives me a list of those payers. So it narrows the display of information, so all I have to deal with are the Medicare payers. Now, you most likely will have one for home health. You should have one for hospice because the requirements are different for the hospice payer. You may also have those where you can create a denial claim. And so the denial payer for Medicare has some different requirements as well. So to select one of these, I'm just going to select one. These are the names of my payers, and in my system, you might be with NGS. I don't think you're with Palmetto, but you might be with NGS. So I'll go ahead and select that one. Now, I've already got one payer listed, but I want this payer for this admission to be number 1. So I'm just going to change it. The start date. I highly recommend that the start date for this is the same as your referral date, because you need this payer to be active when you activate the patient. So if the referral date's on the 20th and you don't activate the patient till the 22nd, if you have this dated on the 20th, then it's active once you activate that patient. So that's what I typically recommend for this one. So this is for any patient's admissions. If you are changing payers, then you'd want to end an existing payer, and then the effective date would be when the new payer starts. So when you can start billing the new payer, that would be the effective date. So this, for new ones, I always recommend that you use a referral date. That way it's active when you activate the patient. Billing address for even payers other than Medicare. You could have multiple billing addresses. Your electronic claims, we do have some billing addresses in our system for some of the electronic payers, but electronic claims, you'll want to select that. Contacts. Now, in some places, especially managed care payers, you might need contacts, because if you have 10 case managers that are your contacts for billing, you might need to know which one you need to talk to. Now this one tells me I need the Medicare Beneficiary ID. The HIC number, you can no longer use that since January 1, 2020. So you need the Medicare Beneficiary ID. And I'm just going to go ahead and type this in. You can identify if this is going to be a Medicare secondary payer. I don't see this used very often anymore. And then accident-related cause. So you could identify whether there was an accident, if the person needs coverage because of an accident, some type of liability, or so on. So you could change that. Then once you're through adding the payer, hit your save. Now, here's why I don't even have this one on this one. Let me add a different payer real quick. Let's go with this one. I'm going to put this at the top. Okay, another number. GRT5. Okay. Okay, this is what your payers should look like. This one in my training environment's not set up correctly, but this is what your payers should look like. You should have green and red bubbles where there are requirements. The green ones means that they're satisfied. The red bubbles mean that the requirement's not satisfied. So this means that there's a profile tab, simply activating this patient and with their Medicare beneficiary ID and effective date and stuff that completes the profile. The requirements tab that pulls over from your organization payer, so that was already set up. So that pulls over too. Then authorizations, well, this one shouldn't have authorizations on it either. Somebody's been playing with my file. So your authorizations for Medicare should be in NA. Eligibility, you should have a bubble sitting here for eligibility. And when it's a red bubble, that means the eligibility hasn't been verified yet. When it turns green, it means it has been verified yet. And so here's the reason that you want to add this payer as soon as you come into the pending patient encounter. When you add Medicare and any other payer where we can check eligibility through an automated process, the minute I added that payer, it'll send that eligibility verification request to your MAC, which is your Medicare Administrative Contractor. It will send it to them immediately. And then you'll get the response back in a couple of minutes. So while you may still be working on this referral, you'll have your response back from them. We will tell you in Workbasket that you have the response. And you will actually have access to come back in here and update that response. So you're going to flag it, yes, they're eligible. It will automatically determine when to check the eligibility for the next month. And every month after that, as long as the patient's active on service. So we will automatically check eligibility every month while the patient's still active. So the reason, again, that you want to put this payment source in here for the eligibility is so that the eligibility verification can be checked immediately. So we'll do that for you. Once you put in that payer, really the next step you want to do is schedule the initial services. Now, for home health, it is set up to schedule the initial assessment visit for the primary disciplines. For hospice, it is set up so that you could check, you could schedule all the disciplines that you know you have to provide to every patient. So it would show you your volunteer, your social worker, the hospice aide, nurse. If you check the chaplain, it would be there. But there's also an exception table. So if you do want the first visit to be scheduled for home health, like you want a home health aide visit scheduled, and you want the social worker visit scheduled, the very first one, there is an exception table to that that'll allow you to do that from here. So if you want to use that, I see somebody says they have an audio issue. Anybody else have an audio issue?
Sounds good to me.
Doesn't look like Jamie's connected any longer. She's got the view, but no audio. Let me just type back in here. Oops. I'm just sending her a quick message. Okay. Okay. Okay, so she sent me another message. She says, it's just me. Okay, I was wondering if it was you or we must just be me. Okay, so let's go ahead and continue. All right, so I'm going to check the disciplines that I want to schedule, and it will put the date that you want to schedule these services. So if I wanted to start the service today, I want them to go out and do it today. I could schedule it for today. I could schedule it for tomorrow. I could schedule it for the next day. So I took my referral today, but I'm not going to start this until tomorrow. So I'll just change this, and I'm not going to send the therapist out until the day after. Okay, and once you hit the save, what it's going to do is it's going to take those two services and put them on the patient scheduling calendar as unassigned. And now when you look at this, you'll see that that link to schedule the initial assessment visit is gone. And I have a new link on the screen instead. So now I have the scheduling link. So I can access the schedule. So I select the scheduling link. Now I'm going to quickly show you how to assign an individual scheduled service to an associate. And when we go through the scheduling training later on, you'll learn about all the other features and functions are to the scheduling. Once I do this and get back into my patient encounter, I'll kind of explain more of this. Okay, so here's the one that's sitting on my scheduling calendar that I scheduled for tomorrow. It's a skilled nursing service, which we knew because that's what I selected. If you just select the service on the calendar, select your edit, it will present you with a list of associates that are for that discipline. So I want to schedule my RN assessment visit. I'm going to do it on the 22nd. And let's say I called the first person and they said, I can't do it. Then you call the second person and they say, yeah, I'd be happy to do it, and select that second person. And so once you do that, you can hit your save. Now, you do have the ability to schedule time in and time out. Most of the time, I do not see this entered for your professional staff, any of your clinicians. I do see this done for your paraprofessionals, like your hospice aides, home health aides, volunteers. If you're providing Troy workers, homemakers, and stuff, I typically do see time scheduled for them, but usually for your clinical team, I usually don't see the time scheduled. So I'm just going to go ahead and select my save. And so it does assign it. You can actually see that there's somebody's name attached to it now. Then again, all I have to do is select the service, select edit, find an individual that can provide this service. It's a PT assessment visit. You can see that. If you need to put in times, you can do that. And so we'll just go ahead and assign that individual. I called them, they said, yes, I'm fine with it. So you're going to assign it to them. So you can see these are assigned. Now, from the scheduling screen, you can get back into the patient encounter by selecting a patient's name. So that it's a link that'll allow you to go back into the patient encounter so you can toggle back and forth between scheduling and the patient encounter. I want to drop this onto the profile tab. Okay, so this is something that you guys will probably have to make a decision on how you want to do this. Some locations, intake department, they enter the referral, they enter the payment source, they schedule the initial assessment visit, they find and assign associates to those scheduled services. Other locations have accounts receivable specialists who puts all the payer information in. So the intake people just enter this and get it to a pending patient encounter. Accounts receivable specialist does the payer information. They may do authorizations and prior authorizations, those types of things. And then you could have a scheduling coordinator that schedules the service or finds and assigns those services to somebody. So I wanted to show you this because these are the steps you can go through and you can determine what's the best approach. If you were a small location, I may say that the intake people should do every step. Larger locations, it may be better off because you have experts that know the payers inside and out, and you have an expert scheduler that knows your entire staff. Okay. I've got another question. If it is not assigned to a clinician, then whose work basket does it go into? You would decide who you want that to go to, because you'll have scheduled services that aren't assigned to anybody. So there's actually, under the scheduling action items, where you can assign it. So it says no scheduled services. So you'd be able to assign that Workbasket task to whoever you want to receive it. I think once we get through some of this other training, Molly, it might be to your benefit if I go through Workbasket with you individually and get your associate set up. So I could ask you some specific questions about what they are or are not responsible for, and make sure that it gets set up correctly for you. Because Workbasket flows beautifully. We have had some other offices that assigned Workbasket to everyone that didn't care. So we can take a look at that. We may have to adjust some of your security for that. So that's probably what we might want to do since you have a larger team of people. So we can look at that. We can take a security that's specific to your agency and make sure that you've got those pieces set up correctly. And then I could probably go through Workbasket with you and look at your team and ask you the appropriate questions. You okay with that? Okay. All right. Now there's one last thing I want to show you. And this you can decide as well. I find it unusual that we have agencies that do this, but there are some agencies that like to activate the patients right up front, whether they know they're going to bring them on service at this point in time or not. Other agencies, the patient can be activated through the initial assessment service node that does work through both home health and hospice. So when you're activating a patient, there's a link here, and if you need to activate one in the office, you can do that by selecting the Activate Patient link. And this is what the screen looks like. The Activate Patient screen is very similar to your hospice. So you have a verbal start of care, which I said we were going to do this on the 22nd because that's when I scheduled the service. I'm going to start it on the 22nd. Oops. Unlock me. Okay. Let's try this again. Okay. So I've got my verbal start of care, my start of care. This is where I'm going to be seeing this patient. You could have more than one address, so you might want to make sure that it's the right address for you to go see the patient. The admission source and admission type. I put this in on the Create Referral page, but if I hadn't, this is where you'd be adding it. If you're going to be using Case Manager and Clinical Managers, then you could be able to select your Case Manager out of the list. And by the way, this list uses your active associates. Also, if you're doing any type of team assignments, you can set these up as teams as well. Now, from a hospice perspective, this pretty much stops after exclude patient survey. So if you want to exclude them from the survey, whether they're home health or hospice, you check this box. This section is part of CMS's value-based purchasing program that they had every intention of rolling out clear across the United States several years ago. So we built this in the system based on what they were originally going to do. And it is sitting out here for your home health agency. If you are part of the value-based purchasing program, then you'll want to make sure that you answer these appropriately. If you're not, you can still answer them appropriately, or you could leave them at unknown. But that's what this was set up for. So at some point, they keep telling us that they're going to roll this out eventually. It's all out here for you. So if you're not part of the program, you could just ignore this lower section. Then just hit your save. Now, once I do that, my patient's going to switch. Let's see it do this. Let me play with it once more. I didn't get it activated, my fault. 122 and 22. Okay. Let me just check one of these. Now I can do this. Strangest thing. Oh, strangest thing is not activating my. Oh, I know why. My fault. Let me try this once more. It keeps them in pending if you put in a future date. Okay, now we're good to go. Okay, so once you activate the patient, it's going to update some additional information, like you'll see the start of care date on here now. If you got added any other information, which a lot of times comes through your initial assessment visit when it's completed, that information will be updated. Your profile tab under current encounter, it will update the rest of this information for your current encounter. So a lot of this was blank, where we'll start of care, residence, county, and so on. A lot of that was blank. And so it's as you start updating and adding more information into the patient encounter, it's going to start updating the various sections. When you change information, remove information, then those sections will change. So now I've got an active patient encounter, and this is my electronic medical record for my patient. Okay, so this actually, which we're ending a little early, but this is actually concludes today's training. So I want to see if anybody has any other questions. Okay, so the next training, I'm going to go back through the rest of the tabs that are in the patient encounter file. So you're going to learn the features and functions about all the other tabs except the medications, orders, and service notes, because our clinical team is going to show you how all of the features and functions on those three tabs work as part of the clinical training. So if I don't have any other questions, you guys have a great rest of the day, and we'll talk to you in the next training.
Thank you. Also, I think you should participate in the